All right, case 5 was a little different treatment than straightforward single visit. Saw this patient on Monday for a retreatment, came in 10 out of 10 pain. Started a retreatment and we had a significant amount of drainage coming. So we left the case open, and the case has been open since Monday. And today's Thursday, had her back. And traditionally on these cases in the past, what I would do is at this point in time, I would flush it out and place intracanal medicament, such as calcium hydroxide, seal that up and leave that for another couple weeks. Since I incorporated advanced irrigation, the EdgePRO, I have no qualms about going ahead and finishing the case, provided the drainage is done. So that's what we did here. We went in there and isolated the case, employed no instruments used at that point in time, as we'd already done that on Monday, and did the disinfection, went through the solutions protocol again with the EdgePRO, disinfected, cleaned it out, and dried the case, and went ahead and restored this case. Had a fantastic result. And we'll follow this case up pretty closely for the next few months, see the patient back in about 3 or 4 months, and anticipate to have substantial amount of osseous regeneration at that time. Okay, lots of water here. So this is a case that we, was it Monday? Came in, intense pain. We opened the case retreatment and got a lot of drainage out of it. So we left it open to drain for a couple days, looking good. She had immediate relief. We'll come back in here, flush this out, and seal it all up. So again, coming back with our coronal. If you feel anything, let me know. Coronal conditioning. Again, the number 3 tip. Now, one of the things, there's this kind of misnomer in endodontics that you can't leave a tooth open. And the more you do it, you'll see that there's a lot of benefits on these at times to leave the tooth open, particularly if it's draining. It provides a lot of relief. What it also does is it changes the environment from an anaerobic to an aerobic, and those bacteria that are anaerobic cannot survive. All right, we're going to go to our mid-root protocol now. Okay, so we have the 200 micron tip on. Mid-root, go ahead. Smear clear. So Nikki's now coming in with EDTA. Get mid-root, activate on the way out. Okay. Yeah, let's come back to hypo. So on Monday, we did the removal of the old filling material, gutta percha, got it cleaned out. Found some additional anatomy in there, cleaned it out, and then, like I said, we left it open. So today all we have to do is come back, make sure it's done draining, and run through a couple cycles with the EdgePRO for disinfection, and then we'll seal it up. final flush out of the solutions with water. So again, the final rinse I always do for 1 minute. I just stay in the chamber or right in the orifice for this. Okay. So I like to come back after everything's dry, just reconfirm links. ml off the buckle, 20. MB, 19. Distal buckle and distal lingual. 19.5. All right, let's start with a 20. Set around a little bit. Give me another 20. No one. Perfect, okay. So I just went back with a little honing file and just allow my cone to seat to the right length that I wanted it to. Blue. Another 20. Yep. Blue. Hot shots. 200. All right, so we got the MB and ML condensed. Gonna go to about mid-root. I'm gonna backfill both of these. Give me a paper point again. Distal lingual and buckler, 20.
Distal buckler, 19.5.
19.5, perfect. One more 30. So I'm going to trim this distal one a little more from that. Okay. I'm going to trim the distal just a little shorter than some. The abscess that was there, so a little inflammatory root end resorption. Good. That's right, length. Hand me that other 30. System B. All right, we're unpacking these back too, and then we'll seal up the top part, okay? All right, so we got the distals, we're gonna backfill those. All right, ETOH. Give me a cotton pellet. Okay, root canal is finished. Give me the other mirror. Rinse. Etch. Brush. We'll do phosphoric acid first. Okay, there we go. Rinse. HF. I'm going to come back and etch the porcelain surface. Porcelain primer. We're going to prime the porcelain. And bond. Like that. Cure. So I'm going to come with a dual cure, followed by with packable on top of this one. Cure. Explore. Cure. Okay, let's smooth this up. And polish.